Hi, welcome back to video 2 in the Medicare series. We're going to talk about Part C. I call it AKA Medicare Advantage Plans. Medicare Advantage Plans, or Part C, you'll hear the term used interchangeably. A lot of them were designed as zero premium plans that cover drugs. And their concept was there's no need for a supplement plan. Matter of fact, it's illegal for anyone to sell you a Medigap policy or Medicare supplement plan if you have Part C. This kind of allows seniors, 65 plus folks, to use their Medicare funds to purchase private insurance that fits their needs and their budgets. The nice thing about it is some of these plans have enhanced benefits. They may cover some dental and vision care in their plan as well. Part C of Medicare usually has more benefits, costs less out of pocket. It has benefits that Part A and Part B of Medicare don't have. It has choices. So a lot of folks ask the question, or I ask the question, why would anyone want the old program or traditional Medicare A and B? What you're going to find is that there is a huge movement toward these Medigap plans, Plan C, or Medicare Advantage plans, and approximately 31% of the U.S. population has opted for the plan. But interestingly, New Jersey only has a 15% penetration who have opted for Plan Medicare C. So what's interesting there is it something that is specific to the Northeast or whatever? No, when we look at California is at 38% enrollment in their Medicare option C or Plan C. And New York, obviously, is on the East Coast, is at 37%. So you'll find in each specific state some anomalies in there. Why a state is not more involved in it. With nationally, we're looking at, we're roughly somewhere almost about a third of eligible seniors have opted for Medicare Advantage C plans. Now, what's important to understand about going to an Advantage plan is you are still in Medicare. You have all the rights and privileges and protections of Medicare. You still get a complete Part A and Part B coverage in the plan of Part C. You can only join your Medicare Advantage plans at certain times during the year with open enrollment or when you come of age in. You can join a Medicare Advantage if you have a pre-existing condition. So if you have a known medical problem, the answer is yes. If you have end-stage renal disease that's specifically excluded, you cannot go. You have to stay in traditional Medicare. You must follow plan rules. It's very important. Now, the main difference between your Medicare Advantage plans and your traditional A and B is you may have to go and get a referral to see a specialist. Folks may be familiar with these PPO type plans that you need to get a referral to go in there. Sometimes you do, sometimes you don't. If you go out of a plan's network, your services may not be covered or your costs could be higher. And in most cases, it applies to an HMO or PPO plan within the Medicare Advantage. Now, some Medicare Advantage plans will let you go outside without a problem, but you have to be very careful and make sure you've got the right plan, or at least you understand which one you have. Medicare Advantage plans cannot charge more than original Medicare. So the interesting there is for chemotherapy, for dialysis, skilled nursing facility, they can't charge what original Medicare will pay. Medicare Advantage plans have a yearly limit on your out-of-pocket cost, which is different than your Medicare A and B. Now, there is no technical out-of-pocket limit. You can go through a lot of deductibles and coinsurances, but Medicare Advantage plans have a cap. In other words, you will not pay more than a certain dollar amount, and after that, 100% of your items are covered. Let's say you go into a Medicare Advantage Plan C, and whatever reason you don't like it, and you want to go back to traditional Medicare A and B. So if you join a Medicare Advantage plan for the first time and you aren't happy, you have special rights to buy a Medigap policy if you return to Medicare, original Medicare, within 12 months of joining. So basically, if you go in there and you don't like it and you say, I don't like this, I want to go back, you can buy a Medigap policy and go to the original Medicare A and B. If you had a Medigap policy before you joined, in other words, let's say you were in Medicare, traditional Medicare A and B, for whatever prior to joining a Medicare Advantage, could be a year, 2 or 3 years, whatever. You may be able to get back your Medigap policy if the company still sells it. If not, then you can buy another Medigap policy. Now, if you joined Medicare Advantage when you were first eligible for Medicare, and you decide whatever reason, maybe a few years later, you don't like it, at that point you can go and choose any Medigap policy without evidence of insurability. So there's some benefits to trying it. Obviously, you want to do your homework and research and learn a lot more about each particular Advantage plan. We're going to talk about Part D, which I call AKA as your drug plan. Medicare Part D was pretty interesting. It's kind of an evolving program that's ongoing. It's been changed since it was pushed through by President Bush and signed into law. It's been changed by President Obama. It's currently changing each year until eventually a lot of this, they refer to the donut hole, will be completely removed. But basically here you have a yearly deductible. We're going to go through each part and hopefully you get a little bit better understanding how it particularly works. You pay the full cost of drugs until your deductible, which if for 2016 is about $360 before your plan will pay anything. So technically it's simple, straightforward. You have a deductible of $360 which you pay out of pocket, at which point then the plan will pick up part of its share. As you look into your copayment, after your deductible, you have a copayment, and your plan will pay its share for covered drugs until they pay, plus your deductible, it reaches $3,300 for 2016. Now, once you hit that number, so you're paying part of it, the company's paying part of it, plus your deductible, once it hits out of pocket of $3,310, then you go into the next stage. In the next stage is what they call the coverage gap. Once you and the plan have spent the $3,300, the gap coverage starts. And this is what the numbers are going to change as the years go on, I believe into 2020. You're going to pay 45% of the cost for a brand name prescription and 58% for the cost of generic drugs. So as that kind of progresses forward, these numbers will get less and less and less. Catastrophic coverage is when you have a lot of medical bills or prescription bills. After you hit an out-of-pocket cost, including your deductibles, your copays, of $4,850. Then the coverage gap ends, at which point you're paying 5% or $265 for generic, including brand name drugs that are treated as generic, because sometimes there is not a generic drug for a brand name prescription. So they'll treat that as generic, and $6.60 copay for all other drugs until the end of that year. Now, this is a kind of an ongoing deductible. If you hit your deductible and you're in the catastrophic coverage at the end of the year, let's say late in December, technically at January 1st, the whole process starts again, where you go through your yearly deductible, your copay, you're in the gap, and then you go back to catastrophic coverage. If you think that's tough to follow, the answer is it is. And unfortunately, it's going to change each year forward. Now, what happened with Obamacare, the Affordable Care Act, is it'll steadily reduce the prescription drug coverage gap over the next several years. So by 2020, prescription drug gap coverage will be basically completely closed, meaning the donut hole will cease to exist, and you will pay a 25% cost for your prescription drug until you reach your annual out-of-pocket limit. So what that's trying to do is to simplify the plan to some extent. So hopefully it'll get a little clearer as time goes on, but don't get overly concerned about learning the numbers for 2016, because in 2017 they're going to change, and again in 2018, until it's finally resolved all in 2020. Now, how do you get started with Medicare? How do you file, and how do you start the process? Well, you really want to start and understand that you need to apply for Medicare. Is a 7-month window. It's 3 months before. Actually, you should really do it 3 months before your 65th birthday. So you look here, it'll show age 64 and 9 months. If you're collecting Social Security already, you collected 62, 63, whatever, you're collecting Social Security, then you're automatically enrolled in Parts A and B. If you're not collecting Social Security yet, you're not getting your income checks, then you may then you should apply 3 months before your 65th birthday. Now, your enrollment periods for Part B is you have an initial enrollment period, and they say 3 months before and 3 months after your 65th birthday. So that's a total of 7 months, because the month of your birth is that actually the 7th month, or it is actually 1 month, 3 before that 1 month, and then 3 after. You have a general enrollment period from January 1st to March 31st of each year. Be careful if you miss your deadline. We'll talk about that in a little bit. Then there's a special anytime while covered by a current employer's plan, or you're working mid-year, you're after the open enrollment period, you're separated from service, or you retire, whatever. You have 8 months to actually enroll in your Medicare. Now, when you look at Medicare's, the parts of Medicare, it's very easy to apply for Medicare. You can visit the Social Security website. That's ssa.gov. That's how you can apply for your Medicare there. You can also call the Social Security office at the numbers on the screen. They do have hours Monday through Friday. You can also apply in person at your local Social Security office, or if you're a railroad worker, you can apply for your Medicare through the Railroad Retirement Board and the numbers on the screen. So they give you some different options on there. It's pretty flexible. Most folks lately are applying online. They find it a little more comfortable and probably a very good way to do things. Let's say you have some additional questions and you want to do a search, and you look around and you find out that if you have some more specific questions about a plan, you check this site. It says call Medicare.com, and you'll be able to speak to licensed insurance agents, and they'll be able to help you. And makes sense. Getting a licensed person to help you is a good thing, I guess. So what the problem is, and that's why the arrow is pointed to Medicare.com, is Medicare.com is a very different site than Medicare.gov or Gov. Medicare.com is a private company that sells Part C of Medicare and Medigap plans. So what you're realizing, and I tell folks, you got to call with your eyes and ears wide open. What you're actually getting is a company that sells these products. Now, their information may be good, it may not be as good, but it's always going to be somewhat slanted to selling their products. So just so you know, you can always email me. I have the software that checks out all these plans for free, so you can get a good feel for which ones will work well within your situation. That's the end of video 2. We're going to do a quick review of some of the highlights. What we reviewed in this section was we highlighted Plan C. We talked about the benefits, the number of people that have chosen Part C of Medicare or the Medicare Advantage plans. We also we highlighted a little bit about Plan D, your prescription drug plan, your deductibles, your copay. We talked about the donut hole. How do you get started with Medicare? The parts, the cost, where to apply. And most importantly, I just want to review the wrong website. A lot of folks don't realize, .com, .gov, very different websites. If you do have the questions, I'll gladly help you with, help looking at which of the plans do the best for you in your particular situation. So thank you.
Hi, I want to congratulate you on finishing section 2 of your video series. Again, I want to stress, if you have questions, make sure you take advantage of the Q&A, review your handouts, and you always have the chance to go back and review the video as we go forward. Very excited, looking forward to seeing you at the end of part 3. Thank you very much.